Dr. Ben Spencer.
Thank you, Mr. Deputy Speaker. And I'm going to speak briefly to make sure that fellow colleagues can get in on this important debate. I'm going to go through the four measures and then come up with some big questions, I think, that we need to ask about what we're doing and how things go forwards. The first measure I want to talk about is the self-isolation SI. That makes quite a lot of sense, and I welcome the government for bringing in this change and bringing in the daily testing. Now, on the vaccination of health staff, I will declare an interest. I used to work as a doctor. My wife currently still works as a doctor. I really do have no issue with this measure going forward. When I had to go through medical school, I had to be vaccinated. And I would flip it on its head, which is if my relative went into hospital and caught COVID or was being treated by someone who was unvaccinated and got COVID and became very poorly from that, I would be very concerned about that happening. So I do think this is fundamentally a basic duty of care issue, but I recognise there are different views on that. On face masks and the mandatory face mask provisions brought in, I do struggle with these measures a bit, because this, along with the working from home guidance, is going to cause harms. And given the Secretary of State's update today on the Omicron wave that's coming forward, I do wonder what actual impact this is going to have and what the harm-benefit ratio accordingly looks like on this. But, there we are. But my real issue is with the COVID status certificates. Now, there's many reasons to be concerned about COVID status certificates, but I'm going to focus on one. As a doctor, I've spent my career looking after people who are marginalised, people with severe mental illness, people with learning disability, the digitally excluded. And looking at these measures and the explanatory notes today, I cannot see how one can show evidence of a negative test without having access to the internet, without having a phone, without going through that, or how any validation process can go through. And it's very clear to me that this is going to exclude people, and I can't support excluding anyone, but especially those people who are marginalised, most marginalised in our society. Yep. But my big three questions are really what comes next. So I had a chat with the leaders of Ashford and St Peter's Hospital Trust, the trust of my constituency, in terms of what's happening and what their plans are for the next few weeks. And they're telling me that already, because of the pivoting towards vaccination by primary care, they're going to have to look at shoring up A&E, because there's not going to be the GP capacity and people are going to go through to A&E, and that may have a knock-on effect in terms of them having to cancel elective care so that A&E can be shored up. Now, they don't want to cancel elective care. They're a great hospital trust and they think they can get through and they can still do some elective measures. And one of the things asked me to ask ministers today is, can they have flexibility in terms of what they do around elective care and try and keep that going as much as possible? But there will be a cost to this, in terms of missed GP appointments, in terms of missed screening. We've already seen what the cost was in this past year in terms of waiting lists, etc. And I'd like to hear from the Minister what the plan is to recover NHS as usual after we have got through this wave. Because trust me, a protected NHS is not an NHS where GPs are going off and abandoning routine care and focusing on vaccination. A protected NHS is where you can get your blood pressure screening, is where you can have that conversation about your mood, where health visitors see young families and can have those very important conversations about, does a woman feel safe with her husband at home? My second question is, what happens when the next vaccine escape variant comes? Because I think we all feel that that's inevitable after this wave. We'll get another one coming through. So what's going to be the plan to stop us having to repivot like this again? What is the long-term living with COVID strategy? And my third question, which is really more of a plea, is that the costs of this pandemic have largely fallen on the shoulders of our children. Yep. Please, can the Minister confirm that there are no plans for mandatory restrictions on schools and we will never close our schools again? Yeah.